LauraLynn Children's Hospice opened in 2011. It was brought about by the inspiration and determination of a lady called Jane McKenna, who sadly lost two daughters, Laura and Lynn, and started on a quest to fundraise and to build Ireland's first children's hospice.
The admission was all new to us. I came in with Martin, we sat down with the nurse and there was a folder of paperwork to fill out. I can't remember what time I came in at, but it was something like 3 hours long.
So before Vitro, we had a lot of documentation in LauraLynn. Certainly where you have that volume of variety and that volume of documentation, number one, it's very hard to collate it all. Number two, I would have concerns and did have concerns as to how well the different elements of a child's needs were being communicated amongst the multidisciplinary team.
When we started looking at an electronic medical record for LauraLynn, I suppose some of the biggest challenges that we had at the time were really looking at lack of efficiency that we had when we were using a full paper-based system. We had issues around the basic things like legibility of handwriting, consistency, using multiple versions of different forms. We had documentation stored in lots of different locations. So if you're a clinician on the floor, you might have to walk between many different locations in order to just source a file. So the reason that we chose Vitro in particular, we had looked at different systems that were out there, but for us really, Vitro was the one that most closely matched our needs here in LauraLynn. For me, one of the big factors that we were looking for was something that was going to be user-friendly. And that was one of the biggest things because obviously within LauraLynn we have a huge variety of staff and they presented with some different varying skills in IT. So there was a lot of anxiety when we even mentioned electronic records.
So Vitro is a clinician-centric EMR that's bespoke to hospitals and adapts to the clinician's workflows and pathways within that hospital, fully integrated with all hospital systems.
Vitro is our electronic medical record system, our EMR system here in LauraLynn, and it's capturing all of our patient data from admission, referral, admission, all the way through, and all the direct care documentation that's related to each child and family when they come in.
So it's very important when we do the check-in with the staff here that they go through everything really diligently, and now it's just a matter of minutes. It's fantastic. On the new system, it's all up. If there's any medication changes, we'll just at a press of a button, it's changed.
The nice thing about Vitro is it takes what we have in our paper forms and transposes it into an electronic system, so it still looks and feels very similar to the actual templates that the nurses were used to using and the clinicians had been familiar with all along. So the implementation of Vitro here took around 4 months, which was really, really fantastic for us.
What was brilliant about Vitro was how quickly that process happened. Now there was no shortcuts taken. It didn't happen by, cutting corners. It happened because the system itself was so easy to use and so user-friendly for the staff.
So I just received training in Vitro last week, and I think it's a testament to how easy this system is to use that it took an hour and a half for me to be trained in the entire system.
Now we have individual user access, so we can set permissions against each user based on their profile. I might be able to have read access to other information that I need to be aware of. However, I can't go in and edit somebody else's notes. It really increases staff's accountability for completing notes in a time-efficient manner.
Since it started now in the last 3 months, we've seen an improvement in the quality of information. It makes it easier to streamline the information that we're giving. As well, there's less duplication of information.
There's no risk of staff carrying out out-of-date practices.
Is going to be a huge benefit to the children who use our service. It allows us rapid access to their information and helps to streamline the care that we're going to give them.
With Vitro, you can type in what you're looking for, you can search like you would with a Google search, which is really time-saving. We used to have to count in every single medication and write it out at the expiry date, etc. But now with Vitro, all we have to do is count them because the whole list of medications is saved for every specific child. It's just so specific to the child, and it actually, I love the fact that it doesn't allow you to admit the child without having all the details filled in.
As a doctor with very typically bad handwriting, I think that anything that takes away paper and improves my legibility is a really good thing. It's great for patient safety and means that all healthcare professionals can read each other's notes and get a really good record of the care of the child as they move through the system.
I was on annual leave while the whole programme was put in place. So I kind of taught myself it. It's very user friendly. It's just, if you're used to using your own laptop or if you have an iPhone, it's very straightforward.
So another reason that we chose Vitro as our EMR is that it gives us an opportunity to use the system in the community. We have an outreach service here, a LauraLynn at Home team, who go out and deliver care to families in their homes in the community. And rather than having to write notes out there in the house and actually manually leave a paper copy, we can now use Vitro in an offline mode where the nurses and carers will be able to upload the children's information, go out to the home, write in their notes, and then sync back into the system when they come back in and upload all of the information. So it saves that duplication where they would write information in the home, come back into LauraLynn and have to rewrite everything they had written. So that's a huge saving in time for them. So we have paper files that are archived off-site, which is actually a huge cost to the organisation on an annual basis. And when we are able to scan all of that information, historical data, and save it onto our systems here, we'll completely get rid of that cost. Even down to a basic level, our actual ordering of reams of paper. Now we're seeing that we were not using up our paper stores as fast, and that's been a saving of about 35% to the organisation on a month-to-month basis. Initially, when I tracked some data, we were seeing our admission times were improved by about up to maybe 16%. But now, several months down the line, we're seeing that as staff are becoming more familiar with the system, that our efficiencies are nearly halving the time. So it's really great for our families that it means that their admission process is so much faster.
Having worked with other organisations and implemented other systems in other organisations, I would say that this was a system that was the most readily adopted by the organisation. Project management, as in the support from Sláinte in the introduction of the Vitro system, was second to none. The team, as well as the team here in LauraLynn, worked so well together, and they were always accessible, always available, and were on site if needed as well. So I really couldn't fault Sláinte in how they assisted LauraLynn to roll out and implement Vitro. The support was excellent.
They give him the utmost care, the medical side of things, 24 hours when he's here. We'd be lost without her, we really would.